It's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home, otherwise medically complex clients at home, which includes BIPAP, CPAP, ventilation, home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, as well as home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, and we also provide palliative care at home. We also send and have sent our critical care nurses into the home for emergency department bypass services, and we have done so successfully in the past for the Western Sydney Local Area Health District, their In Touch program. So today I actually have an email from a case manager in a hospital who says, "Hi Patrick, I'm a case manager and I have a patient on my caseload that was sent to the emergency room a few months ago for assessment of lethargy. In the emergency department, she was found to be having non-stop silent seizures. Her airway became obstructed and they intubated her. She was also diagnosed with sepsis due to a UTI. UTI stands for urinary tract infection. She then was found to have sustained several moderate strokes. They have stabilized her and she's no longer having seizures. However, when they tried to extubate her last week, within an hour, they had to re-intubate her again because her trachea had narrowed and they had to insert a pediatric tube. She no longer requires the ventilator, but she now has a tracheostomy and will need the tracheostomy most likely for the rest of her life. We questioned if she just had sustained swelling to the trachea, which could be resolved on its own. But the doctor said her narrowed trachea is considered to be permanent. So now she has a tracheostomy permanently. The patient has an intellectual disability and normally lives in a group home. The group home is not sure if they can take her back safely with a tracheostomy. I'm not even sure what to even ask or advocate for. We certainly don't want to see her winding up in hospital or in ICU for months on end, let alone let her go to a nursing home, which I don't believe can take tracheostomy patients anyway. Can you help? And this is from Rose, a case manager from a hospital. Now, Rose, thank you so much for writing in. Again, this sounds like bread and butter for us. We've done it over and over and over again. We've been in business since 2012 with intensive care at home. Like I said in the intro, we are highly specialized in ventilation, tracheostomy care at home with 24-hour critical care nurses, which is what a patient needs when they have a tracheostomy and or ventilation requirements. Now, in terms of your client going back to a group home, that is possible with intensive care at home, because at the end of the day, we go wherever the clients or patients need care, right? And we are providing services to patients in group homes, right? Whatever is considered a patient's home, we can send our critical care nurses to, right? So your client or your patient absolutely needs 24-hour nursing care with critical care nurses. Otherwise, she is at risk of dying, right? A number of patients in the community have died on ventilation/tracheostomy because they didn't have 24-hour intensive care nurses, right? And having 24-hour intensive care nurses with a minimum of 2 years intensive care nursing experience is actually evidence-based. So what do I mean by that? Intensive care at home services have been around since around the year 2000, started out in Germany. And of course, enough research has been done with intensive care at home over those 2.5 decades. We've been operating with intensive care at home in Australia since 2012. And we also follow best practice guidelines, which is the home mechanical ventilation guidelines, which clearly document that a minimum of 2 years intensive care nursing experience is required to look 24 hours a day to look after ventilated and tracheostomy patients in the home, adults and children. Anything less than that puts a client's life at risk, and clients have died because they didn't have 24-hour critical care nurses with a minimum of 2 years critical care nursing experience. And again, Rose, you will need the same here for your client. And like I said, we are sending our staff into group homes for 24 hours a day critical care nursing. And we can provide services wherever the patient considers their home, right? So no problem there. You shouldn't be worried about it. And you also shouldn't be worried about the funding side of things. Not that you have mentioned anything about the funding side of things, but there is absolutely no issue around that. So next steps, talk to us and talk to us more about the funding side of things, how we can obtain the funding. Once again, we have always been very involved in the advocacy for our clients for the funding. We've done that from day one successfully. Otherwise, we would not be in business. Right? Once again, keep in mind the cost of an intensive care bed is around $5,000 to $6,000 per bed day. It's the most expensive bed in a hospital. It's also the most sought after bed in a hospital. Therefore, you should not worry about the funding, because the funding body who's funding the ICU bed definitely has an interest in cutting the cost of an ICU bed by 50%, right? And the ICU needs an empty bed, right? So it's a win-win situation providing intensive care at home. I hope that answers your question, Rose. Now, with intensive care at home, we are currently operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider all around Australia, TAC in Victoria, iCare in New South Wales, NIISQ in Queensland, also WorkSafe in Victoria, DVA all around the country. Our clients have also received funding through public hospitals, private health funds, as well as departments of health. We are employing hundreds of years of intensive care and critical care nursing experience combined in the community, and that is unmatched in 2024 in Australia, I believe, and nobody else is bringing this high skill level into the community than we do. We're also the only service provider in Australia in 2024 that has achieved third-party accreditation for intensive care at home nursing. No other provider in the country maintains and applies the high standards than we apply in the community. Now, if you're at home already and you are in a similar situation where you are ventilated, have a tracheostomy, or you have a tracheostomy and you're not ventilated, you're on BIPAP, CPAP ventilation, or your family member, and you know that you don't have the right level of support, you don't have the critical care nurse that you know you need, I encourage you to reach out to us to get the right level of care, get the right level of funding. Because we help our clients to advocate for what is the right clinical care they need and what is also safe and evidence-based. We have put stops to ICU readmissions the minute we show up. That is our skill set. And other patients have died, unfortunately, that didn't have the ICU nurse 24 hours a day with ventilation and tracheostomy. We're also providing level 2 and level 3 NDA support coordination. And I have done an interview with our NDA support coordinator, Amanda Riches, and I have put a link to the interview that I've done with Amanda below this video in the written version of this blog. We're also providing TAC case management in Victoria. And if you are a critical care nurse looking for a career change, I encourage you to reach out to us as well. We're currently offering jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury-Wodonga, in Bendigo in Victoria, as well as in Warragul in Victoria. If you have worked in critical care for a minimum of 2 years, pediatric ICU, ED, and you have already completed the postgraduate critical care qualification, we will be absolutely delighted to hear from you. And because we are offering a tailor-made solution for our clients, which includes regular staff, our clients want to have the same staff coming over and over again, because they are very vulnerable, and it's all about building those critical relationships and having regular and stable teams. So if you are looking for agency work where you can come and go, this may not be the right fit for you, because we're looking to engage with you on a long-term basis, and our clients want to engage with you on a long-term basis. So it's all about building those critical relationships with our clients and with us as a provider. And if you're an NDA support coordinator from another organization and you're looking for nursing care for your participants, especially with high and complex needs, you should come to us And if you are also needing help with advocacy, we're also doing NDIS specialist nursing assessments. And if you're an NDI, and if you're an intensive care specialist or ED consultant, we also want to hear from you. We are currently expanding our medical team as well. And if you are working in ICU or in ED, we can help you eliminate your bed blocks in ICU, ED for your long-term patients in particular, or for patients that are coming back on a regular basis. We are here to help you take your pressure off ICU and ED beds, and you won't even pay for it. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, please reach out to us as well. We can help you there as well. Lastly, if you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately. Once again, contact us at intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and for families with intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have, and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on the show, and you will get notification for the YouTube live if you're a subscriber to my YouTube channel, or if you are a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.